today we are going to deal with severe mental illness in relationship to COVID-19. I know that corona COVID-19 is a challenge to the world, and if it is a challenge to those who are assumed normal, then those who are mentally challenged is a bigger challenge for them. Then it is deemed necessary we look into their plight and see how we can help them in this their moment. But one thing you need to understand, are you hearing me?
Yes, yes.
Let me.
Yes.
Okay, one thing you need to understand is that severe mental illness is defined in a sense that if you have a mental illness that severely has some impairment in the functioning of the patient, that is regarded as severe mental illness. Those days it is denoted as schizophrenia, like people with psychotic disorders, but people also with bipolar affective disorders could have a severe mental illness, severe depression, okay, or patients with schizoaffective disorders, dementia, neurodevelopmental disorders, especially with challenging behaviors in autism spectrum disorder. I will not be too technical in this webinar because I know that SAF is an activist group which is quite good in public awareness in terms of those who are mentally challenged, especially mental health. Okay, then when we talk about severe mental illness, these are vulnerable population and they have a higher risk of contracting COVID-19. Then if they have a higher risk of contracting COVID-19, then we should definitely be aware of how to prevent them from contracting this severe disease. It is also expected from them to have a worse outcome when it comes to the infection, because what happened when you said severe mentally ill patients, they might not understand the policies of isolation or quarantine, which can also have some severe or dire effect on the outcome if they are infected with coronavirus. Then when it comes to lockdown effects on severely mentally patient, it has different challenges on them. One, there is a disruption in services, especially for mental health services during this time. Yes, in terms of human resources, it's another problem because if there is a lockdown or there is laying of workers trying to prevent themselves from being infected, then less workers will be coming to work, and this will have a severe effect on their welfare, especially in terms of helping them. Then disruption of services is one of the challenges of the lockdown in this pandemic for those who are mentally challenged, especially the severely mentally ill, because the severely mentally ill are normally within the institutions. Even if they are not in institutions, sometimes they are in homeless dwellings, or sometimes, or maybe they are in hospitals where the services of professionals or those who really need to help them is quite needed. Availability of medicine, as you can see, even in the, I don't know, I'm sure you have seen that during this lockdown, there is a shortage of medicine a little bit in the country, and then this also affects those who are severely ill because they are in the institutions, they are in the hospitals. Then comes to coronavirus causing shortage of medicine for these people is quite challenging. It also causes more relapse, or even uh, maintaining their stability becomes another problem. And then also in terms of safety, maybe for the staff, because some of them could be aggressive, this is also a challenge to the staff working. Changes in the environment, because COVID-19, we all know that has a lot of impact in our environment in terms of hand washing, in terms of the measures that are needed to be adhered to, such as the hand washing, wearing of masks. When you cough in, you have to protect yourself, from spreading the virus, and the other measures that are when you suspect maybe somebody has coronavirus with fever, cough, difficulty in breathing, one should alert the healthcare professionals so that they can take the necessary measures. For them to rationalize these measures that are laid down by WHO or the Ministry of Health is something that is not easy for them, because they are severely or mentally challenged. Then when it comes to their vulnerability, most evidence shows that because of they have a high risk of infections in terms of this COVID-19, and then the outcome of if they are infected, the outcome will be quite there on them too. And then, as I've said, when it comes to the preventive measures like the physical distancing, of doing that, it becomes something that is quite difficult for them. And then the risk of infections within them, or even the severely mental patients and the staff, is quite higher if one is suspected, or if one is infected with coronavirus. Then when it comes to the preventive measures, which is the what I call the lock in time, it has no cure, then the preventive measures is something that we should all hang to at least to prevent ourselves from being infected, or also from transmitting the infection. Then they also need to know all what it takes to prevent themselves, but frankly, if for most of them to logically analyze, logically able to adhere to these preventive measures, will be quite difficult, and then quite challenging for workers working in the mental health area. Then the effect on infection control is another problem. We have said adhering to preventive measures, and then cognitive awareness of what is COVID-19 is quite challenging. We all know that, yes, those who are severely mentally ill, they have a problem of cognition, and then they have a problem of their behavior might be quite disrupted. They have irrational behaviors, and then their emotions also are quite disrupted. Then that understanding of what is COVID, how to prevent COVID. If I am a suspect, I need to isolate myself. It becomes quite challenging on them. higher behavioral risk of contracting coronavirus is quite eminent because they might not even observe the basic hygiene, which is one of the problems in severely mentally ill patients. And then in COVID-19, we know that hygiene, hand washing is quite important in the prevention of acquiring COVID-19. Um, then, um, then we all know that also that severely mental ill, they mostly such as psychiatric hospitals, especially Tanka Tanka. Is the only hospital in the country, and then it takes a couple. Then most of the time, the capacity is up to 100 or 90 at all times. And then imagine if we have COVID-19 infection within those patients. It could be quite difficult, not for the staff alone, but also for the patients. Challenging to also those who are mentally ill. We all know that, yes, those who are mentally ill have COVID-19. It's a huge challenge for them to have access to healthcare services if they have any other physical health issues. But in this pandemic, which most of the hospitals are also down. Most of the hospitals are also downscaling their staffs, and then they are attending to uh, mostly emergencies. Then it becomes challenging to attend to them. If a severe mental ill patient is a suspected of COVID-19, which I said the isolation policies becomes something very difficult for them to understand. And then this is due to their cognitive impairment and poor understanding of the rules or the policies of isolation. When it comes to severely mentally ill patient and COVID-19, risks of infections, risks of patients that are severely mental ill to have higher risks of relapse, higher risks of instability in terms of management is quite high. But when it comes to severely mentally ill patients, hello, are you getting me?
Yes.
Okay. When it comes to severely mentally ill patients with COVID-19 infections, is another big challenge because what happened, even their medications have some associated metabolic syndrome, which causes like hyperlipidemia, weight loss, impaired glucose control, which are some of the side effects or the unwarranted effects of the medications. And then these also are predisposing factors for COVID-19 infections. We all know that COVID-19 infection is higher in those who are having comorbidities like diabetes, hypertension, cardiovascular diseases. Then their medication also increases the risk of these certain conditions. And these are factors associated with severe infection. There are some other medications like clozapine, which also I know it's just good you know that some of their medication also causes what we call low white cell counts in people, like we call it granulocytosis, which also poses an increased risk for COVID infections for them. Then you have benzodiazepines, which we also use like diazepam, to tranquilize them, or lorazepam in restraining some of them. And then they have some negative effects, like they cause respiratory depression, whereby in COVID-19, you know that one of the symptoms is difficulty in breathing. Then in our context as a country, uh, COVID-19 poses a great challenge to those who are mentally ill in terms of uh, human resource availability for them to help them solve their needs in the hospital. Um, in terms of financial constraints, we know that COVID-19 has challenged our health ministries. It has taken a lot of financial, uh, um, uh, it has deep into the accounts of the health ministry, and just to deal with COVID-19. Then those who are vulnerable, such as mentally ill, who also need a lot of money to help them, becomes a challenge. Then poorly resourced in terms of professionals, medication shortage, which is also which we are right now, in fact, having. And then the Ministry of Health at the mental health desk office with Bakari, who are they're doing very well to help us to get some of our medications. But it's quite difficult at this moment. Limited family support, severely mental ill patients, we all know that, yes, even without COVID-19, family support has been a challenge for them. Then in this pandemic, where the family support has to be shared with other family members to prevent them, and it means that everybody has to take that responsibility to prevent the spread and the acquisition of COVID-19. Then that that care that should have been given to them is quite limited, because now everybody is quite engaged in him or herself to prevent him or herself from become infected with COVID-19. Then that limited family support towards them is a big challenge, big challenge in this pandemic. Even before the pandemic, which is one of the things that we always highlight in terms of family taking responsibility to help those who are severely ill, severely mentally challenged, uh, because most of them are left on the hands of the healthcare workers to do all what is needed, which is also challenging to us because we don't have the resources to do that. Then, then this pandemic poses a big challenge for all of us, especially those who are mentally challenged, especially the severely mentally ill. Then in summary, what I want us to understand here is that COVID-19 has a big challenge on those who are severely mentally ill, not only those who are severely mentally ill, because COVID-19 also has big challenge on those who are not mentally ill, because we all know that COVID-19 poses a lot of stress, and then this stress can also trigger those who are not even mentally challenged to be mentally challenged, and those who are mentally stable, who are mentally challenged and they are stable, to relapse, and those who are mentally ill at this present becomes very challenging for us to stabilize them. Then you can see that it has three dimensions. That is, from the normal population, it can push them to be mentally challenged, because we know that, yes, COVID-19 comes with anxiety, not for all of us. And then too much of anxiety itself is a mental illness. And then not only anxiety, but some can push them even into depression. It can push them to exhibit some behavioral difficulties, such as externalizing behaviors. They go into drugs, illicit drugs, uh, which could have a very severe impact on their mental health. Then COVID-19 infection pose a threat to severely mentally ill patients, and poor cognitive awareness of severely mental ill patients to the preventive measures and isolation policies makes it more complicated. And it is a duty of the state to cater for the mentally challenged in this pandemic. Family support is what we yearn for and what we advocate for all the time. It's more needed today than before because of the threat to COVID-19. I think I will stop it at that, and then we discuss around it, and then if any, I welcome contributions, questions, then I can definitely elaborate more on this topic. Thank you. Over to you.
Thank you so much, Doctor. It is quite wonderful to have you on this discussion and platform. We thank you for taking up with your time and being on board with us, and to everyone that is also following the platform so that we discuss and promote the agenda of mental health in the Gambia and also the globe at large. So I think you definitely made justice, and you have clarified some of the um, points and some of the issues that have been challenged, that has been the challenge for people with severe mental illnesses. And one point really kept me interested to know that the focus is not only for people with severe mental illnesses, it's also affecting same as the quiet people with a good mental health. But the question here is, how are people with severe mental illnesses facing? What is their condition? Because, for instance, if I can imagine the stress I go through, the emotional affection, and then how will it be to somebody that does not have a good impairment? And then how can they cope with these restrictions and so on? They have a life that is, want to go out, walk around on the street, you have curfew somewhere, a homeless person is also another where, you know, when it comes to even accessing food, when it comes to, um, are they also receiving some support from other people? Like you can see that many are giving some beneficiary allowances and things like that to support families with food and things. But the main people with mental illnesses in general, what are they facing in the community? If we can share, maybe as a group that support mental health agenda, can come up with an innovative activities where we can be involved to support people with mental illnesses. So the question I asked you earlier on was it that you have an observation based on an increment on the increment on patients relapsing, and because of is it because of this what triggered the high demand of medications? Because there was a medical shortage, and it was also published everywhere that if people can support due to medical shortage in Tanka Tanka. And how does it actually happen? Because it's a little bit weird.
Yes, I told you that during this pandemic, we all know that there is not only psychiatric medications, but there is a shortage of medicine generally, and then this also affected the psychiatric medications. Then, if there is a shortage of medicine, psychiatric medicine, then high likely there will be high risk of relapse, because most of them, especially when you're talking about severely mental ill, if you're talking about people who are moderate or mild mentally ill, yes, talk therapy, other behavioral therapy might really help. But those who are severely mental ill, they highly need their medications to maintain them, at least to stabilize them. And then if there is a shortage of medicine, then uh, the high risk of relapse will be definitely high. And then we've been seeing that most of our cases that are discharged are coming back as soon as possible to the hospital, because they were not getting their medications. They will go to the outpatient unit. These medicines will be prescribed to them, but they cannot even access them at the private settings because the medicines were not available. This definitely has increased the the relapse rate of those who are mentally challenged. And then furthermore, in terms of when it comes to COVID-19, we all know that most of the hospitals have scaled down their services. Then this also poses a big challenge to those who are mentally ill, because some of them to have access to healthcare service now or access to the outpatient units becomes a problem. in terms of even transportation, going to the healthcare service. We know that the transportation system, the commercial vehicles are not quite functional. Or even for them to adhere to the rules of the preventive rules by wearing a mask, or that social or physical distancing within the vehicles, or physical distance wherever I come in a public setting, it becomes a challenge to them. And then they rather be at home, or even there are people who would rather keep them at home than taking them to the outpatient unit, which is another problem for those who are severely ill, especially in mental illness. Then rate of relapse is high, which we need to understand. Access to health to the outpatient unit is a challenge to them. Then family support, which now the family should have definitely helped those who are vulnerable, and then now everybody seems to be vulnerable because of the pandemic. Then they suffer. They suffer more than the others, because that love and care, that attention that they needed might not be given to them at all times. This is quite challenging for them. I see that Mahmoud wants to ask a question. Mahmoud? Hello?